we begin tonight in Canada. The coronavirus is spreading in Manitoba and in other parts of the country at an alarming rate. And there is new national modeling on where things could be headed. The new projections show how we could slow the spread. If we reduce our contacts with other people by 25%, the curve should bend back down. If nothing changes, though, in the way we behave, the projection shows the curve climbing steeply. Canada could hit 8,000 cases a day by mid-December. And if we increase our contacts, we could hit that mark by November.
In communities where the cases are rising quickly, we need to keep our contacts as limited as possible. So when you're thinking of seeing people outside your household, ask yourself, is this absolutely necessary?
Here are the case numbers today. Quebec recorded more than 950 positive tests and 17 deaths. There were nearly 900 cases in Ontario and 9 deaths. Alberta set a new daily record with 622 cases. Manitoba also set a record, 480 new infections. We will take you to Winnipeg, which is moving to code red in just a moment. But first, Abigail Bimman on the big picture and what it could mean for the weeks and months ahead.
On the day before a different-looking Halloween, the country's top doctor is already setting expectations low for Christmas.
But we do have to celebrate them differently, all the way to Christmas and probably beyond. We're working really hard on vaccines and new treatments. But until then, big parties are off.
Keep your contact groups small. Stick to those in your household as much as possible. That's the message again as officials released new modeling.
We have to continue to engage in these behaviors, even as it becomes frustrating.
COVID-19 cases keep climbing, and so do deaths. Now an average of 30 Canadians are dying each day.
While we have consistently observed the highest incidence of COVID-19 among young adults aged 20 to 39 years, we're now seeing a concerning rise in the incidence among individuals 80 years of age and older, which is the age group at highest risk.
Teresa Tam says more needs to be done to stop outbreaks in long-term care. But the pattern of outbreaks is shifting, with many more now linked to private social gatherings than in the spring: weddings, funerals, community events.
Some of these events are considered super spreader events, with large numbers of contacts involved. These put significant strain on public health capacity to interrupt transmission.
You can see here hospitalizations are also on the rise. An average of 1,100 people are treated each day, but that's far less than the spring peak of 3,000. Dr. Tam says that's in part due to better treatment options and the younger age of patients, but warns, like everything else in this pandemic, things could change. Abigail Bimman, Global News, Ottawa.
The spike in cases in Manitoba means Winnipeg will move to code red on Monday. All other areas will be elevated to orange in the province's pandemic response plan, and new restrictions will be in place for a minimum of 2 weeks. Test positivity rates have hit new highs, 8.6% across Manitoba and 9.7% in Winnipeg. Brittany Greenslade is reporting from Winnipeg tonight.
The intensive care unit beds in Winnipeg are filling up. The system is being overwhelmed, and capacity is a major issue.
I would argue that that breaking point was probably within the last 24 hours, and everybody should be very concerned at this point in time.
One Winnipeg hospital doctor, who Global News has agreed not to identify for fear of repercussion, has seen the first-hand effects of COVID-19 and the struggle it's placing on our healthcare system. He says they are right on the edge of making life and death decisions.
Having to choose between patient A and patient B because patient A is 5 years younger and has 1 or 2 less health problems, that's not fair.
The province says while there is some capacity, we are at a critical point.
We are not there yet, and I think we need to do everything within our power to do it. So I'm not ready really to have that conversation. I think we still need to fight this fight.
Extra capacity is being added immediately, with the province gearing up overflow space and redeploying staff where possible.
I'm hoping that we can turn this around now. We're obviously getting close. I said on Monday that this was going to be the challenge of our lifetime.
One they say is going to take an effort from everyone. Brittany Greenslade, Global News, Winnipeg.